Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about Medicare open enrollment and how it affects your practice. Open enrollment for Medicare is actually coming to an end very quickly. Every year, Medicare open enrollment is from October 15th through December 7th. So there's about a week left for Medicare recipients to be able to change their coverage for the 2026 year. You might not be aware that this actually affects your practice, so that's why I'm doing the video today. So what is Medicare open enrollment? I kind of briefed on it just a second ago, but it's an annual period where Medicare beneficiaries can switch between traditional Medicare and Medicare Advantage plans. They can change their Part D prescription plans, and they can add or drop a supplement plan to their basic Medicare Part B plan. A high percentage of patients switch plans during this window, just so you know, and it can affect your revenue cycles if things are not asked appropriately by your staff and prepared before 2026, or actually even the start of 2026. So we're gonna jump into that, okay? So why should you care? Well, insurance changes means coverage changes, and that means billing changes, and ultimately it means financial changes. That is why it matters. And I don't know what the percentage of patient volume in your practice is Medicare, but my guess is it's probably pretty high. I haven't actually dealt with a lot of practices that don't have a high percentage of Medicare just because the high volume of the population has Medicare, and it's going to affect you. Some of the changes that will take effect are copays, deductibles, plan formularies, authorizations, referral requirements, just to name a few of the big heavy hitters. If staff doesn't verify the coverage for patients starting in 2026, practices are going to deal with claim denials, mad patients, payment delays, which is never good, especially during deductible season, high AR, which nobody wants, and Medicare Advantage penetration continues to grow every year, meaning that more people are signing up for Medicare Advantage plans because there is a lot of simplicity for tracking purposes for the Medicare beneficiaries, and usually they have better coverage. So if they can afford it, they sign up for it. The most common problems practices face during open enrollment are that they don't realize how many of their patients are actually switching plans, but the patients don't know they're switching plans either. So unfortunately, this population makes it, they're a little bit less informed because it's so complex. I mean, think about how difficult it is for all of us in the healthcare world to understand all the ins and outs of Medicare, Medicare Advantage, supplement plans, all of that, and trying to have somebody who has no medical background or healthcare knowledge trying to figure it out. So you have a lot of patients that get notifications or questions if they want to switch their plans, or maybe their plans are being discontinued and they're being auto-enrolled into a new plan and they don't realize that they need to do research, or they just pick something not realizing the research they need to do. So a lot of patients unknowingly switch plans, and a lot of times it's financially driven as well because they are on a fixed income many times, and the motivation of lower premiums rules the decision to change. And then once they change, they realize when they're trying to bill or use their insurance, maybe it wasn't the best change. So that's hard because they don't check provider networks, and sometimes they have to see different doctors than they're used to and things like that. It's really sad in my opinion. And it's not until after a patient has been seen and a claim denies that this is realized, because the staff up front didn't look closer at the cards that the patient has for their insurance. The Medicare Advantage plans are always changing. You have a lot of the commercial payers that are getting more into the game, and many of them restructure their networks or change prior auth requirements and rules every year. So you have to stay on top of that. It's important that now you are looking into that so you know when the new year starts. And then they also will end up having new referral requirements to catch, I don't think it's intended necessarily to catch people off guard and not end up having to pay for things because things get missed. So authorization rules change, referral requirements change, and then just coverage in general will change. When you have outdated insurances in the system and the staff is not updating it correctly, then claims are going out incorrectly, they're getting denied, and it's just not a good situation. So you have to make sure that you're helping remind your staff up front now that they need to be updating all of that at the beginning of the year. Some patients after December 7th will have their new information before even the new year starts. And they might come to you and they might say, hey, this is my new card for next year. Here's my information for next year. I would encourage your staff to load that in your system and scan those cards in now if they can. And hopefully your EMR or EHR system will allow you to put effective dates and termination dates on the different plans, so it will continue to build our 2025 plan when they're seen in 2025. But it will terminate at 12/31/25, and anything that gets billed in 2026, there's an effective date on the new plan. It will bill out under that. Hopefully you have that, and if not, or if you're unsure, look into it and have a plan in place to be able to use that feature. Or if you don't have that feature, put a plan into place with your staff on how you're going to handle that. Okay? Be proactive, not reactive. For medication disruptions, Part D formularies shift every year. That was one of my biggest issues as a medical assistant. And medication authorizations, step therapies, all of those things are going to be changing, and it's very frustrating for patients who have been on certain therapies for a long time. So just be mindful of that and maybe have some re-education to your staff that's going to need to be getting prior authorizations, looking at those new formulary requirements and step audits to make sure that you guys are prepared, okay? And then, of course, you're going to get swamped with refill requests, not only at the end of this year to use up their benefits before the end of the year, but you're also going to get them for the people that need new prescriptions at the first of the year. And then maybe if formularies change, authorization requirements change, it's going to be even more cumbersome. So you have to plan now and anticipate that. And then there could be some patients who forgot to select a plan during open enrollment. It happens. And so they may have a gap in coverage, which is never good, but it could happen. And that can affect your scheduling and your billing. So just be mindful of that, okay? So what should you be doing now during the open enrollment period? Remember, open enrollment is October 15th through December 7th, where Medicare beneficiaries are going to be evaluating their current healthcare coverage and maybe changing. So you're going to make sure that you're educating your patients, maybe have signs at check-in that says, if you're a Medicare patient, please notify us of any plan changes. And again, hopefully you've worked through some of those proactive approaches that we just talked about. You have to train your staff to ask every Medicare patient about their appointments and their coverage and the dates and everything like that. Your staff, I mean, at the beginning of the year, in my opinion, it shouldn't just be Medicare. It should be all patients across the board. They should be scanning in new insurance cards. They should be checking the data between the insurance card to what's in the system to identify any changes and verify active coverage, all of that jazz. However, Medicare is going to be even more important because we know it changes at the beginning of the year. And again, collecting those new cards, scanning the front and back, very, very important. And if they have it before January 1st, that's even better. Verify their coverage before January 1st. So maybe the last 2 weeks of this year, or even the last 3 weeks of this year, which is rapidly approaching, look ahead and forecast your schedule into 2026 and all your Medicare patients and start verifying their eligibility now. And maybe just give them a friendly call reminder, hey, we know that your insurance might be changing at the first of the year. You're scheduled in 2026. We will need you to give us that updated information when you have it, and see if they will give it to you ahead of time to verify. It's always a good idea, being proactive, not reactive. Because the other thing you have to make sure is that they're not going to be required to have a primary care assignment through the insurance. A lot of Medicare Advantage HMO plans are going to require that. And if it is, and you're a primary care doctor and the insurance automatically selected someone else, that can cause some issues. So you need to make sure that you're not only training your staff to look for these things, but they also need to be checking to see who that assigned primary care provider is, if the insurance plan requires it, and making sure it's updated to you before they're seen, or it could be a billing disaster. And then if there's any new payer IDs that need to be added because there's new plans or things like that, those need to be added to your practice management system, your EMR for billing, and address changes for insurances. All of that can be done ahead of time to be proactive as well. And then you also have to make sure, again, authorization for prior auths, referral requirements, knowing about those, being prepared for those, and educating your staff to be on top of that so that you're not seeing patients for free when they require any of them. Just a little tip is that the impact to revenue cycle is huge already during a difficult financial time of the year, which is usually the first quarter or two because of deductible season. January is a huge month for denials across the board, especially for Medicare patients because of incorrect insurances, wrong plan type was billed, you have missing referrals, you have missing authorizations because of termed coverage, you could be getting denials, things like that. So being proactive and being mindful of that is going to definitely help your bottom line, okay? You're going to have increased call volume. Patients are going to be confused. They're not going to know what's going on. They're going to look to your staff to help them. So be mindful of that. Pharmacies are going to be requiring prior authorizations for medications. That's going to be, that's always a big one. You're going to have, if you're a specialist, you're going to have a surge of referral requirements and authorization requirements for services rendered in your practice, not just medication. So be mindful of that. And then because of the delays, you could be dropping claims late to the insurance to process. Your accounts receivable or your AR is going to be really big and it could age really fast. It can snowball. Your billing team's going to be stressed. Your front office is going to be stressed. And it all goes back to being proactive instead of reactive. So anything that you can prepare and be ready for is only going to benefit you and your staff and your bottom line. Okay. So just make sure that you're looking and seeing which Medicare Advantage plans could be changing in your area, doing the best you can at looking into the ones that exist now and see if there's any mention on the websites about changes coming in 2026. Ask your patients to communicate anything to you that they become aware of so that you can be aware of other patients with the same insurance. Things like that are really going to help, but you have to be prepared. You have to communicate with your staff, retrain them, teach them, and just know that they will have the support from you and any other leadership when time gets tough, okay? If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you have not already, and please share this with your colleagues whom you feel would benefit. I appreciate the support, and we will see you next time. Bye-bye.